The next fiscal year for state government does not start until July 31st, but the debate about what Massachusetts should spend is already here. Governor Maura Healey kicked off the proceedings last week by rolling out a roughly $63.4 billion proposal that would increase spending about 3.8% over the current annual budget, fueled in large part by sharply rising healthcare costs. There's an awful lot to unpack in this bill, and that's what we'll do here on the Codcast, CommonWealth Beacon's podcast about policy and civic life in Massachusetts. I'm joined by a pair of think tank leaders with expertise and different perspectives on the state budget. Jim Stergios, Executive Director of the Pioneer Institute, and Viviana Abreu-Hernandez, President of the Massachusetts Budget and Policy Center, are here as our guests. Listen along as we discuss the sustainability of spending growth, the intended use of surtax dollars, and how major changes in Washington, D.C. have altered the budget process here in Massachusetts. Let's get into it. Let's talk annual budget season. This is something that's going to last months, probably up to half a year from now, but we are officially in fiscal 2027 season, even if we won't actually enter fiscal year 2027 until July 1st. I want to start with the big picture and overall level of spending. If you count the surtax and the Medical Assistance Trust Fund, the governor's budget would increase spending to roughly $63.4 billion. It's about a 3.8% increase over the current annual budget for fiscal year 2026, which we're in right now. It's a little bit of a mixed bag. That's lower than 3 of the past 5 years in terms of year-over-year increases, but it's also still a higher rate than inflation and the rate by which budget writers expect tax revenue to grow. Jim, I'm going to start with you, but Viviana, please jump in after. How sustainable an approach do you think this is for the governor to take?
Yeah, I mean, to me, I guess my broadest take on this is that this is a steady state budget at a moment when there is a structural change underway that makes it a crisis, and the crisis is not being dealt with. The 3.8% number sounds okay until you realize there will be likely supplementals of a certain size, as happened this past year. So it's going to be outside of that, even the band that you've mentioned, Chris. I think the big issues I have with it as well is you can see it in the way the budget's crafted. The budget has gotten to us an economic an unaffordability hole. I mean, we've been growing for the last 15 years. The budget has grown in real terms about 30% since 2010. Household income has grown only 13%. So we're going way past what our taxable capacity is. And you can see in the way they're using the surtax money. They are reneging on the promise of the 2022 surtax. Those dollars were meant to be investments in the future, not plugging operational holes. So you can see that the crunch in terms of the economy, people leaving, which we can talk about, the fact that our corporate taxes are lower is a sign that there's something maybe not so good going on here in terms of the economy, as is true also of the unemployment rate. The budget is not doing the hard things it needs to do to structure itself for a future that can actually grow the budget, which means economic activity.
And Viviana, go ahead. What's your initial sense on the sustainability of this spending increase and how it fits into the bigger picture economic trends that the state finds itself in?
So I am seeing a budget that is very similar to the previous one, with the exception that there is an increase in the surtax of the fair share. And part of the reasons that we are seeing that increase in the budget is because there is more money to be able to be distributed in education and transportation. Having said that, we cannot look at this budget without understanding what is happening at the federal level with the federal budget cuts that are going to affect directly the most vulnerable populations, as Medicaid, SNAP benefits, and WIC are being cut. And in additional eligibility requirements for participants of the programs are increasing, and that is a possibility that hundreds of thousands of Massachusetts residents may lose benefits and access to health care and food benefits. So we need to look at the state budget, but not forget that it is in relation to what is happening at the federal government. So that partnership that exists in terms of the federal government contributing to Medicaid and in other programs that sustain the most vulnerable populations like SNAP, that partnership is being changed, and it is not in the advantage of the state. It is in detriment of Massachusetts' budget.
So, Chris, could I just jump in one more thing there? And I completely agree with Viviana about the very challenging federal administration that we have and what it means for the state, especially for programs that deliver absolutely necessary services to the vulnerable. So I take that very seriously. There are a lot of great researchers like Mark Williams of Boston University who've discussed this at length, and I think it's persuasive. It's a no-brainer, yes. But a budget is an expression of priorities, not only to make sure we're delivering services to the vulnerable and making the investments that we need as a Commonwealth, but it's also a set of choices that other states have made. They've made different choices, and those different choices have led to different results. And those different results are, when you're a North Carolina that has worked to reduce its taxes to rein in some of the regulatory excesses that we have here. When you look at what they've been able to do, and they're a direct competitor to us in the sense that people often choose to go to North Carolina or Massachusetts. They don't often leave from Massachusetts to go to North Carolina, but they have the same industry mix. There's the same professional, scientific, technical jobs. And if you look at what's happened in just the last 5 years, they have grown their job base, their number of private sector jobs by 255,000 jobs. We're one of only 4 states that has lost private sector jobs. We've lost 25,000. That differential of 280,000 jobs, real jobs, is their taxpayers, and it's about $1.4 billion in revenues that we're foregoing. And these are annual revenues that show up every single year, and they're not showing up here. And one of the reasons why I think we're losing young people, future taxpayers, people who build a family and grow a family and build a future here, is that there aren't really any jobs because we're not that investable as an economy because we've made some very bad choices. I mean, think about it. The number I gave you, the differential of 280,000, is more than 2 Cambridges. That's a lot.
Let's turn to healthcare, which, as always, is the single biggest area of spending in this state budget proposal. And actually, Governor Healey's fiscal 2027 budget would increase spending on mass health by about double the rate of the overall statewide budget. Officials say that would have been even worse, maybe double-digit % increases, if not for some changes they want to make, like cutting GLP-1 coverage only for weight loss at mass health and capping mass health dental benefits for adults. Viviana, I'll start with you. Does the governor's budget do enough to navigate the pressure points of healthcare costs, or is that an area where you think Beacon Hill needs to do something more comprehensive to avoid another headache over mass health spending and healthcare spending come next year's budget season?
The state is going to have to make difficult decisions at some point. So when you look at the budget, based on my numbers, there is an expectation of $14 billion coming from the federal government and about $8 billion that the state puts to support mass health, which is Medicaid. At some point, the costs are going to lower because the eligibility requirements that are expected to be implemented close to 2028 are going to leave about 200,000 residents of Massachusetts without access to mass health. So there is an expectation of that reduction in terms of the cost. But what is increasing the cost of health care is the cost of medication, because that doesn't go down. Pharmaceuticals continue to increase their profit. But there is also an issue of workforce. So the shortage of nurses in Massachusetts is making public hospitals bring in traveling nurses. And traveling nurses cost between $2.5 and $4 times what a staff nurse will cost in Massachusetts. So if you add to that, we are going to have an increased population that needs healthcare services because our population is growing older. So in that population is going to need additional health care. For shortage occupations, the salaries increase. There is more competition in terms of just getting the highest paying jobs. And we are talking about primary care providers like nurse practitioners and physician assistants and nurses and occupational therapists that provide an extraordinary service, and they are not enough workers. Finally, we have a healthcare system that is broken. So the Affordable Care Act that was supposed to increase patient satisfaction, that's the triple aim, increase population care, positive outcomes in terms of healthcare, and the reduction of per capita expenses, that has not materialized. So while I see that there is an increase in the expense in healthcare, there are some factors that I don't know how much the state has control of. But if I think about investment that the state is making with the fair share surtax that we're going to talk about later, you see that Free Community College is addressing some of those shortage occupations in healthcare. So it's a complicated, but this is something that every state is going through. In addition to that, the federal budget cuts in areas that are scientific research that include diversity, equity, and inclusion aspects of healthcare and education, and the cuts in financial support for tuition and caps in student loans that may reduce the number of people going into shortage occupations in healthcare.
Jim, I'll bring you into this, and I'll pose the question just a little bit differently to you. Can the state continue on this track when it comes to healthcare spending, or do lawmakers and the governor need to take some other significant action outside of the annual budget process to save themselves budgeting pain further down the line?
No, I think absolutely. I think one of the core issues I have with the budget proposal, as I said before, it's a steady state proposal. It doesn't take advantage of the many opportunities that exist to create savings. And look, no one has a magic wand on healthcare. I'm not going to, in a 35-minute podcast, say, whoa, no, we don't have those answers. But I guess I'd say a couple things. One is we often find bogeymen out there and to explain things away. And so one of the things I think gets lost in the healthcare discussion often is the blame often gets put at the foot of the life sciences, biopharmaceuticals, and that sort of thing. And I get the high prices, the high sticker prices that are out there that you see in the news. But if you look at the data on a year-to-year basis for many years now, we've not seen an increase in the overall spending on pharmaceuticals across the United States. Because as these sometimes gargantuan prices that we see come online for a few drugs, and those have to be managed. I'm not arguing with the GLP-1 issue at all. I'm not. But so many drugs are becoming generics, and therefore the prices decline dramatically. When you all take that together, it's a pretty steady state. It's an amazing thing. Sometimes we've seen actual decreases. What I'd say on this issue, because I think there are two fundamental things that we have to do to get healthcare costs in check, at least for a few years. I'm not saying they're long-term fixes to the problem. One is we have talked about price transparency, but we've never delivered on it. If you're a patient, you don't know what the prices are, and you have a high deductible that you're paying. The idea of even remotely shopping for routine things, I'm not saying for, a heart surgery, but routine things, you're not going to do that. And there are really big costs in there. Second thing is on pharmacy benefit managers, about 1/4 of the overall $450 billion we spend on drugs in the United States is pocketed by pharmacy benefit managers. That needs a federal fix, but it also needs a state fix. I'd say the third thing is, and this is the most immediate one, is look, I think Viviana said it before. We're spending about what, 22 billion on Medicaid, Mass Health, another 11 billion on Health and Human Services programs. Even a 1 to 2% savings on that through better management would do us an awful lot of good. And I'm not talking about changing eligibility rules. I'm talking about the following, just as a comparison, because I don't have the data on what they call leakage in Medicaid in Massachusetts at my fingertips. I do know it on unemployment insurance, and it was 22% a couple of years ago, according to the feds. The government did the Healey administration made some changes. Now 16% in leakage. Leakage is basically overpayments, duplicative payments, wrong payments, some fraud, but it's mainly bad management. The Boston Consulting Group has taken a look at major benefits programs, and they have said, look, if you apply the AI tools that we currently have to deal with this and not do audits after the fact, but use AI to make sure we're flagging early on those mistakes that we make in these giant payment systems, you could save between 5 and 15%. Now, government needs to get a hold on this, but I would think within a couple of years, we could get to 1 or 2% savings, and that becomes real money. That's $500 million. So I'm not saying it's a total fix, but I'm saying in order to manage our way through problems and also think first about keeping people here and creating a more affordable Massachusetts, these are things we should do. We should do it on unemployment insurance as well. That's, I guess, there's a lot to talk about the savings pathway not taken in this budget at a moment of critical importance. We could talk a lot about local property taxes too, and the pressures this budget puts on local property taxes. But on the healthcare issue, I think this is we have to agree, we got to manage, right? Government needs to manage actively and not just pretend it's all a federal issue. There is a federal issue, but we can control what we can control, and we should do that.
Yeah, I agree with Jim. We also need to look at the way that we treat patients. You know, we are just looking at the systems in terms of how are we going to fix overbilling to insurance or paying for services that are redundant or are not necessary to the patient. Now, when you think about how it is that we are going to treat a patient, we need to make sure that that patient gains control of their own health. And this is supported with successful and proven best practices of care coordination, direct patient care management, the ability of create a seamless system between the emergency room, the hospital, the nursing home, and the home health. So we have a broken system that reduces the ability of the patient to stay healthy. So that is something, and that will be, Chris, that's a whole different show. But I do know that there are different approaches that Massachusetts can take to reduce the cost of care. But because we need to look at this budget in reflection of what is happening at the federal government, the cuts in Medicaid are going to leave hundreds of thousands of Massachusetts residents without care. Not only that, the cost of the premiums are going to increase exponentially because the Senate still has not tackled the enhanced premium tax cuts for people to be able to get insurance at a reasonable price. So that is something that is going to make healthcare access significantly more expensive for the average resident in Massachusetts and across the United States. So it is both things. And at some point, Massachusetts need to ask itself and the legislators and our governor, what are we going to do with the people that will not be able to access Medicaid because of the new additional requirements for eligibility?
The surtax, as we noted, is another significant factor behind the proposed spending growth. I believe that the governor's budget would use about an extra $300 million in surtax revenue that wasn't accounted for in the current year's budget. So between her fiscal 2027 annual budget proposal and another bill she filed the same day to spend extra surtax money that's already been collected, has not been appropriated yet, those two vehicles together would steer more than $1.1 billion to the MBTA just for operations and just to help the agency deal with responses to issues that the federal government previously flagged. Jim, is the MBTA worth that big an investment?
The MBTA is worth investing in improvements and upgrades to make sure that it's working at the highest level possible, because for our economy, it's an essential service that moves people in and out of the city and out of greater Boston. It's a jewel. We are lucky to have it. I mean that sincerely. It's what differentiates us from so many other unwalkable places, and it makes Boston a much more pleasant place. I say that with a smile on my face because riding the T is never a pleasant experience. So there's a contrast between those things.
Don't say that. I love public transportation.
I don't love it when it's 5 degrees and it doesn't come for a while, Viviana.
No one does.
Not
No
a
one
big
does.
fan. Yeah. I guess, but here's the serious, Chris. Look, I think that Phil Lang is doing a pretty good job. I find it outlandish that we have a $700 million deficit. I feel like using $23 million of the surtax money to plug an operational hole is backtracking fully on the promise of what the surtax was supposed to do. I was not a fan of the surtax. I always thought it would drive people away. I believe that's true. I think the numbers are coming out and showing that to be true. I think the level of investment in Massachusetts shows that it's true. That all said, the people voted for that, and we should respect what the people said. So that means we should put it into modernization, improvements, not plugging holes that are entirely preventable. And here's where I think I would be for investing that money in it if we actually, again, managed ourselves. The T spending is off the rails. We need a fiscal and management control board back because it is crazy. Think about just a couple of numbers. Our bus driver operations have gone up 90% in cost since 2019. The next closest system in terms of increases is Chicago at 40%. I mean, I don't know how you explain that. When you take a look at the pension system, we're only about half funded now, and we're spending well over $200 million. 20 years ago, we're 90% funded, and we're only spending $40 million. This is all money that could go into operations, all money that could go into making sure that all the investments we make are for improvements, upgrades to make sure that the trains are actually running. So, I mean, think about the Pacheco law. For some reason, we can't have competitive bidding for services. Why is that? Well, that's just frankly because the political powers that be don't want that. But many other states make that choice, that they will do competitive bidding to make sure they get value for the money that they spend. So I think we need to go back to that mindset and recreate that fiscal and management control board if we're going to spend this kind of money, because without that, the T has shown itself to be untrustworthy with the public dollar.
Viviana, putting aside the capital end, the modernization end, long-term overhauls, what's your assessment of what the state is set to spend on MBTA operations? Do you think there's a good reason behind that figure increasing as officials have tried to staff up or improve service?
A good, efficient, modern transportation system, it's necessary to make the state more competitive and attractive to foreign and for corporations, and also for families and people to stay in Massachusetts and in Boston. So it's not only the T, we also have to think about the regional transit authorities. And one of the things that for me it's very important that is an investment from the fair share is the free fare in the regional transit authorities. research shows that in the first 12, 11 regional transit authorities that extended the ARPA funding that covered the fare for people that were using the buses, increase the usage of the buses, reduce the time of wait. So it's a positive investment that help people to save some personal money and, without any cost, be able to get to their jobs, take their kids to school, attend parent-teacher conference, go to school. So I think that in addition to the MBTA and making it more efficient and more a better quality, I think that we also need to look at the investments that have been made through the fair share to support the people that need the fares to be more affordable.
On the use of surtax money for operating or recurring expenses, the governor's budget for, I believe, the second year in a row would use about $500 million in surtax funding to pay for Chapter 70 aid increases. This is state aid to K through 12 school districts, and arguably is not a one-time expense. Those annual increases were required in the 2019 school funding reform law known as the Student Opportunity Act. Viviana, are you comfortable with surtax dollars now being essentially the only source of Student Opportunity Act increases? Does that comport with the original intent of the law in your mind?
So I am, I am a researcher in mass budget, and we listen to what our grassroots organizations and organized labor in terms of the education unions, what is their take on the use of this surtax. Just remember that they were the ones that advocated for the fair share through Raise Up Massachusetts, the large coalition. This is the last year, I believe, of the Student Opportunity Act. Am I correct, Jim? I think that this is the last year. And the governor has decided to propose. She has proposed to use all of to support the Student Opportunity Act using fair share. As long as the money is being invested in education resources that are going to improve the system, particularly for the low-income students and low-income school districts, I do not have a philosophical problem with that. So in that sense, I am not concerned about the fact that it's been used for the Student Opportunity Act, because it's more important to provide that funding to the school districts at a time in which the federal government has got so much funding in diversity, equity, and inclusion programs that tend to benefit excluded populations and children like dual language and students with disabilities. So I think that is important.
Chris, I of course have a very different view on that. The people were sold a bill of goods. They bought it. That's their right. This is completely not what was supposed to do. We said it was going to happen, and it happened in California before. It's happening. It's the only way they can get the money because they don't have economic growth. And that's the problem, because what you have is people leaving, and we're going to depend more on more. We're going to be much more exposed and dependent on the surtax money going forward. That is true not just because of the departures, the lack of investment, as we see again in the unemployment rate. It is also that we have a much smaller, the percentage of kids who are under 15 is much lower here than elsewhere. If you take a look at the population 25 to 54, we've grown over the last 4 years 0.2%. The national average is 2.5%. We're becoming old and not bold. We're not taking chances to do something that is going to build. We're just taking care of the status quo, and that's going to run up against us. It's not the right way to approach managing a state or a state budget.
So I will add a couple of things. The Chapter 70 formula, which funds public education in Massachusetts, has a cap in terms of formula, in terms of increasing the amount of money for inflation. So the cap of Chapter 70 is lower than the actual inflation rate that we have been living. So, and we have been experiencing throughout the last years. So that inflation glitch has reduced the amount of money that school districts are getting because of the lack of additional funding that can keep up with the inflation and the cost of education delivery in different districts. So the Student Opportunity Act, as it is being funded as an additional way to provide for services in low income and minority districts, the impact of the Student Opportunity Act in terms of being able to support the education district is not as effective. That is something that I want, just to make sure that we the expected positive impact in producing better education outcomes for these districts may not materialize because the Student Opportunity Act is not as effective because of the inflation glitch in Chapter 70. That's
Viviana,
number one.
Viviana, just on that point, I would just say that we also have a steep decline in the number of students, so that's also reflected in the budget. I think it's also a demographic issue is what I'm trying to say.
I agree with you, Jim, but we also need to notice that the kids that are growing in terms of numbers are not white kids, are students of color. And students that are not native English speakers. The education experience and the education system needs to provide specific services for them to integrate themselves if we actually want an inclusive democracy. So the population that is growing in Massachusetts are those that have been historically minorities, Latinos, and Black students. So we can have a whole different conversation. But yes, Jim, the number of students is not growing, but the ones that are growing are minoritized children.
I agree. One thing just to make my point about old and not bold is I get your points on that. But I guess, so just in the budget, we continue to do universal free lunch for folks, which is something I find mind-boggling because you could actually save quite a bit of money and put that into educating folks who don't have as much, right? I mean, I get the point of I get the point of free lunch for students who are up to, let's say, 300% of the federal poverty rate. No one's trying to be stingy with the program. But that we would go into a place like Wellesley and Weston and provide free lunch is just something that I find a little, it's just not targeted thing. It's not thinking about what to do. Think about what you could do with probably somewhere around $50 to $75 billion in savings through changing that. You could invest in expanding vocational technical schools. Our vocational technical schools can and should serve more minority students. These are jobs that are absolutely less prone to be lost to the advent of AI and the expansion of AI. We need to think about where we're putting our dollars, and we're not doing it in this budget, and we haven't done it for a while.
Lawmakers will hold a series of hearings over the next few months to dive into essentially every single detail imaginable of Healey's budget. Expect hours and hours of testimony, hours and hours of questions from lawmakers. The usual pattern is for the House to unveil its rewrite of an annual budget in April, followed by the Senate in May. Maybe in 30 seconds or less, Viviana, what's one or two things you're really hoping to see the House change when they get around to their budget proposal?
So I would like the House to consider progressive revenue. So one of the things that we did not discuss, so the governor filed legislation to postpone the decoupling of tax cuts to business that were given through the OBBBA at the federal level and that are adopted in Massachusetts. So she filed legislation for that. I would like to see not a delay of decoupling of those tax cuts, but a complete decouple, and save over, through the next 4 or 5 years, a significant amount of money to keep. It's not a new revenue, it's just to keep revenue for not living. I would like to see the state to consider the global intangible low taxed income and increase the 5% to 50% so we can tackle those corporations that are scamming the tax system by hiding money in tax havens outside of the United States. And probably, I would also like to see the real estate transfer fee to be legislated and allow towns to enact the real estate transfer fee. So I think that progressive revenue that could help, and I know Jim is not going to like this, so, but to bring additional resources to the state that are not going to hurt individuals in the state of Massachusetts. I would like to see that, and that will be like my wish list.
Jim, what's on your wish list with as quickly as you can, what's on your wish list as this heads over to the House?
It's all about affordability. It's not more taxes and driving more people away. So some level of focus on savings, and I've outlined a few of them here. We have a report we just put out which outlined about $1.1 to $1.8 billion in savings, many different things. People should be thinking of the people in power should be thinking about tax competitiveness. We're not competitive. We just need to do that. Local aid we haven't talked about at all. Local aid has not gotten nearly the kind of growth that the state government has had. And as a result, we're basically at the state level offloading our budget problems on localities. We need to provide more local aid because we're essentially forcing them to go through overrides and other things. I mean, local aid directed at non-education purposes. That's where it's lacking. And I think the last one is, again, on the theme of affordability. The governor said, I'll think about getting rid of those add-ons to your energy bills. An outside section could definitely get at that. We should get rid of them. People are crying out about this. It's a pretty tough time for lots of people.
That's all that we have time for. I'm sure that we could spend 3 to 6 hours together talking about every detail in this budget bill. Thank you again to Jim Stergios from the Pioneer Institute and Viviana Abreu-Hernandez from the Massachusetts Budget and Policy Center.
Thanks, Chris. Thanks, Viviana.
Thank you so much. It's a pleasure meeting you, Jim. Thank you, Chris.
Thanks again to Jim Stergios and Viviana Abreu-Hernandez for joining me on the Codcast. And thank you for listening. I'm Chris Lisinski. Our production and theme music is done by Charlie Casella. Leave a rating and review wherever you're hearing this now if you want to help other folks find us. And email codcast@commonwealthbeacon.org if you ever want to get in touch directly. We'll be back in your ears next week.